So I too will start with several key messages. One is that I think the conditions required for whole systems change research include being able to look at situations where you've got heterogeneity in context, heterogeneity in interventions, and that take a multi-level orientation. I think we need funding mechanisms to support research with a whole systems orientation, and I've got a couple of suggestions on what those might look like and what we're trying to do in that arena. And I would say that in order to reap the benefits of whole systems change research, we need synthesis approaches that are fit for that purpose, and I think we have a long ways to go yet in developing those. So I'm going to take you on a journey through one Canadian example and one global health example. In the first instance, it was something I was involved with as a researcher. In the second instance, I'm involved as a research funder. So some research perspectives, I think, on whole systems change. Questions perhaps that you're asking yourself and that we might come up in discussion. Is it actually even feasible to think about a whole systems approach to health services research? It isn't what we do as researchers, defining very clear, precise questions and with targeted boundaries and clear parameters and so on. So it is researchable. So in some ways, it's almost the antithesis of what whole systems are about. How on earth then do we approach it as researchers? And I think another perhaps related question is how do whole systems change questions fit with questions of efficacy and effectiveness, coming back perhaps to the triple aims. Are these things something that we need to join up? Are they different, distinctive? And I'll provide some reflections on this. So the example I want to share with you to get started was one that I had involvement with over almost a 10-year period. The Registered Nurses Association of Ontario embarked on what really became a whole systems change approach to the quality of nursing care within the province starting in 2000. And I think one of the things that happened with several members of our team, and Whitney actually was a member of our team, was that a number of us were really embedded in this whole initiative right from the get-go. I was involved in the early focus groups. I was involved in actually developing one of the best practice guidelines. We actually were the leads for the setting up the provincial evaluation for this initiative. So we were seeing things as researchers and embedded in that process. And I think that's important because it actually became the basis then for identifying something that seemed to be emerging. It was an emergent property out of a whole systems change process that we actually decided to tackle through a program of research. I won't go into details about what the initiative has involved, but it has been system-wide developing best practice guidelines related to work environments as well as to nursing practice, and it has involved many, many stakeholders across the province. So there were a number of features, I think, of that best practice guideline initiative that created conditions for whole systems change research. One is that right from the get-go, it had a systems orientation. It wasn't about changing practice in a single organization. It wasn't even about changing practice of a single professional discipline, although the focus was predominantly nursing, but it was very early recognized that, of course, this involved teams of people if you were going to change patient care. The aims of the initiative, the way in which the activation and mobilization of stakeholders occurred, the change mechanisms that were developed and implemented, the outcomes and the impact all had that system orientation. Secondly, there was much heterogeneity in the nature of the guidelines and also in the implementation strategies. The topics were quite a range. The strength of evidence actually varied, but the reality is that you've got to try to do what you can with the evidence that exists. So some of the guidelines are based on stronger evidence than others. And there was a diversity of settings which was also very purposeful in different contexts for implementation and for thinking about spread and scale up. About the time that we were actually planning our whole systems change research project, the work of Tricia Greenhall came out, looking at organizational transformation, and certainly the findings of that were very helpful for us, but I think it's very much consistent with what David Blumenthal was talking about yesterday when he was noting that the strength of evidence that exists is particularly around microsystems. In this case, I would say mesosystems, or at the organizational level, within organizations, and much less at the macrosystem level. So that was an important review that had been done for us. It involved many, many different case studies that they looked at, over 1,000 if I remember correctly. But one of the conclusions that Greenhall reached was that we actually need to look at a whole systems approach to understand and to advance the science in this field. And she didn't say how to do it. She didn't actually even define what was meant by whole systems change, but we decided that that was something we wanted to look at. And as one of the requirements for the funding that we received from the Canadian Health Services Research Foundation, we actually had to do a literature review as the first step. And so we decided that what we would do would be to look at what was out there in the literature on whole systems change. And as one component of that, we found ourselves looking at the nurse practitioner example in Canada, for a number of reasons, as a case study. And it's such an interesting one for lots of reasons, but among them, it's an area where we've had evidence of cost effectiveness for many, many years, but there are many other system factors that have driven decision making and at times have actually halted the uptake of nurse practitioners in the system. And these, you can trace these right through all levels of the system. They go up to the regulatory legislation, funding mechanisms, values and vision, and healthcare reform, and all sorts of related issues. But it actually was a pivotal step for us, and it actually made us rethink one of our projects, and it was actually the one that Whitney was involved with, because we started off thinking that we would just look at the best practice guidelines that had been developed and implemented by RNAO. And we realized, looking at the NP case of a 40-year chronology, that we needed to pick some areas of implementation where we could retrospectively see what had happened over more like a 20 or 30-year window, because that's actually what some of this transformation involves. And we were also interested in innovation that got introduced at different levels of the system. And so we chose 3 different cases as one of the areas that we examined. We also then, out of this, looking at some of the theory, identified our operational definition of whole systems change, which we defined as the uneven nested cycles of adaptation. So you see some of the terminology that has been used by our other speakers, that evolve within closely coupled, complex socio-ecological systems over time. And I think the word to pick up on there is the notion of nestedness and the notion of adaptation, which I think is very much reflected in what Diane had to say to you earlier. But this was an interesting definition for us to work from, and then to think about how do we pull together the findings across the various elements in making sense of what we were learning. So just very quickly, we were interested in looking at intra-organizational system diffusion and inter-organizational health system diffusion. This is our starting point, and system feedback processes. We had 5 different projects, mixed methods. There's a randomized controlled trial there using participatory action research methods, comparative studies. This is our plain language version of the 5 studies that we did. And this is the dynamic model of systems change that we came up with across the learning from all of the 5 studies. And I don't have time to go into details, but I'll just highlight a couple of things. So these were examples of factors that encourage an innovation to flow across systems, the alignment among stakeholders, permeation plans, which we see as being distinct from diffusion, but related to diffusion, really intentional organized efforts to spread change across sectors and through all levels of the system. Paradigmatic leadership, so this is about a paradigm change about how we might do things differently. And it's not a single leader, it's a host of leaders working in networks and supporting and reinforcing structures. And we also saw across the studies a number of system change mechanisms, including how individuals were pushing the boundaries of complex structures to try to actually create a system change that was beyond their organization or beyond their sector. shared ownership of the issue, planning the resources that you need for new models of care, making connections across system levels, and there was a number of different kinds of individuals involved in that process, and then contextualizing the innovations with change agents often having to work beyond their usual spheres of influence. So that, in a nutshell, is some very high-level findings from across those studies. So now fast forward to my role as a funder. So here's a funder's dilemma, getting a square peg into a round hole, right? Because I think that's what whole systems change is really about. And the Global Alliance for Chronic Disease is one initiative that I've had some involvement with, where I think we're trying to move with a whole systems change orientation. This brings together funders from a number of different higher, middle, and lower income countries that are trying to make a dent in the issue of chronic disease in lower middle income countries. And we've been working together first on an RFA, request for applications related to hypertension, and those teams have been funded, and now we're working on diabetes. And we decided that we would take an implementation science focus with this. So implementation science we've defined as what works, for whom, and under what conditions, and is it scalable. So you see elements of a whole systems approach to that descriptor. Our challenge is that we've got these teams working around the world. You can see that they're in many countries. We are bringing them together on an annual basis to look at cross-learning across systems. They're all looking deeply at local context, political context, economic, cultural, and other contextual influences that impact on the effectiveness and the scalability of the interventions that they're interested in. But now we have to figure out how to knit this together. So the easy part of the knitting, I would say, is, you look at common methodology and more traditional reductionist approaches. You figure out common outcomes and you try to roll up information across these. But the whole systems aspect of this that I think is still a big challenge for us is, what is it that we really, really need to understand about the nature of these implementation processes? What is it we really need to understand about the contextual influences on implementation and on the potential scale-up of these initiatives? And how do we find synthesis approaches that help us bring together this huge heterogeneity in context and large heterogeneity, in fact, in the interventions, and make sense of it? But that is a whole systems change dilemma. So I think we need to think about some funding mechanisms that might help with this. Here's just a few ideas, and I look forward to your suggestions. I think implementation science as an orientation is promising, in part because it includes this strong dimension of context and scale-up, and that to me speaks to a whole systems change process and takes us beyond our usual efficacy and effectiveness questions, but builds on that. Secondly, I think we've got to have programmatic research. I think programmatic research allows one to knit together a number of different projects with a common orientation to them. It allows for the flexibility and the adaptability as the system itself changes as you're trying to study it, and you need to make additions or adaptations to the research that you're actually doing. So I think we need more programmatic research, and that means that scientists in our fields need to be familiar with how you even write a programmatic research grant. And thirdly, I think we need to figure out how to develop more system-oriented synthesis approaches that connect up learning across very different contexts, because it is a heterogeneity that we're trying to knit together here. But a lot of our synthesis approaches, our systematic review approaches and so on, extremely well developed, have served us very well, but they don't really give us that whole systems approach, and I think that's where we have to go. So I'll finish there and look forward to the discussion.